Hi, so my name is Mia, and I'm doing my pathogen presentation on HIV, and this is for Micro 22 Lab spring semester. So the scientific name of HIV is human immunodeficiency virus, and the classification is a virus, and the genus is lentivirus. The family is Retroviridae, and we're unable to gram stain it because it is a virus. So you are able to culture it. You can isolate it through peripheral blood mononuclear cells, PBMC, to look at the CD4 plus cells to see if they're infected by HIV. The culture needs interleukin 2 to help the CD4 plus cells grow, and I wasn't able to find a picture, unfortunately. So this is the HIV electron micrograph. A mature HIV cell is 100 nanometers, and this picture is done through a transmission electron microscope. So the HIV life cycle, it first binds, attaching to the host cell, usually a CD4 plus cell. It fuses next into the host cell, and then it does reverse transcription to change the viral RNA to DNA to replicate it. And then it does integration into the actual CD4 plus cells, DNA, and then it starts the replication with the HIV cells using the CD4 plus cells resources. And then with assembly, it makes the HIV cells. And then budding is the last step when it leaves the host cell and it will start infecting other cells. And then HIV is able to increase genetic variation through error-prone viral replication and can create multiple strains, which actually makes it more difficult to kill and could be why they haven't been able to find a cure yet. So this is the HIV cell structure. The picture on the left shows the actual HIV virus, and it has the viral envelope and then the glycoproteins, which kind of look like spikes, but they're not. And then the picture on the right is a picture of an infected CD4 plus cell. So yeah, you could just see how it looks different. And then, so HIV causes acquired immunodeficiency syndrome, otherwise known as AIDS. And then the most affected areas are sub-Saharan Africa, which makes up 2/3 of the global HIV/AIDS cases, and then Asia, Western Europe, and then North America. So the major reservoir is humans, and then the intermediates are chimpanzees and monkeys. And then through increased testing and treatment of HIV positive individuals, this could help control the spread of HIV. And then the individuals most at risk are drug injection users and their sex partners, sex workers, partners of an HIV infected person, and then individuals with more than one sexual partner, and then the LGBTQ plus community, specifically men who have sex with other men, MSM, and individuals that have sex with MSM. So the method of transmission is mainly sexual for HIV, but it's also through sharing needles, blood transfusion, and pregnancy through usually delivery and breastfeeding, which can pass it to the baby. And then the portal of entry is through the mouth, genitals, veins to get into the bloodstream, and then open tissues. The incubation period is typically 1 to 4 weeks, usually after the virus enters the body. And then the contagious period is during the acute HIV, chronic HIV, and symptomatic HIV. So it's a pretty contagious virus. And then the signs and symptoms of HIV. So during acute HIV, most individuals experience fevers, headaches, mouth sores, swollen lymph glands, weight loss. And during symptomatic HIV, this could be fever, fatigue, pneumonia, shingles. And then with AIDS, usually they experience sweats, chills, fevers, white spots on the tongue, and skin rashes. So some of the affected tissues and organs are the lymph nodes, skin, eyes, kidneys, mouth, digestive system, specifically the stomach, mouth, and intestines. And then some serious complications if you have HIV are you can get AIDS, of course, wasting syndrome, which is severe weight loss, kidney disease, liver disease, and then there's also the side effect of neurological issues. And the best way to diagnose HIV is through an HIV antibody P24 antigen test. And then there's also just antibody tests and nucleic acid tests to check the HIV viral load to see how contagious you are. And then for preventative measures, this is typically through condoms, clean needles, and then there's treatment options like pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, if you think you've been exposed to someone who has HIV and you think you might have HIV. So HIV has had a tremendous impact on the LGBTQ plus community. It has created a lot of stigma and unjustified anger, as well as homophobia toward individuals from the LGBTQ plus community. For years, President Ronald Reagan ignored it, even though it had become an epidemic and many people were dying from it. The Conservative Party did little to take action against HIV and aid individuals suffering from HIV. As a result of the HIV epidemic, many homophobic policies are still in place actually in the United States. There's still a law specifically that prevents individuals identifying as men who have sex with other men and the LGBTQ plus community from donating blood without a deferral period. So they need a deferral period that's 3 months from when they first donated and to see if they're HIV negative. But previously, individuals are actually banned from donating blood completely until 2015, and then a 1-year blood deferral period replaced it in 2015. But the current one right now is 3 months. But there's a question of why is this still around when there's countries like Brazil, Italy, and Israel that have all lifted deferral periods for individuals, and they found no increase in HIV cases. This is because the blood is always tested for HIV and other diseases before giving it to individuals, like in a blood transfusion. So that's why there's a question of why is a deferral period even needed when there's proper testing. So we need to reduce HIV stigma and not place the burden on particular groups like the LGBTQ plus community. So that is my presentation. Thank you very much.